Senator Max Cleland on the line calling in. Thank you so much. And been a big fan of yours. I was able to hear you speak in person at Life University. Thank you for being such a great supporter of chiropractic in the past. And and we're really, you probably, after talking with John on our first segment, Senator Max Cleland is really had probably more treatments than any other patient in Georgia.
Maybe the world, Senator.
Well, I need them on my head, but I'm sure a lot of people would agree with that. But basically, I started off with tissue regeneration technologies and Shockwave when I was in Washington, when I heard that that this treatment had saved a number of amputees from becoming amputees because of diabetic ulcers. Right now, if you have a diabetic ulcer, you are subject to amputation on your feet or legs. But Shockwave has an ability to heal cells by stimulating them and stimulate the growth of nitrous oxide in the cell and therefore increasing oxygen. That's the problem with diabetes, that when you have a diabetic ulcer on your toe or foot or ankle or whatever, you can't get oxygen, you can't get blood flow to it, so therefore you need some stimulus. And what happens is that acoustic shock wave, which is used and accepted around the world in terms of lithotripsy, which is breaking up kidney stones, that's focused shock wave. Unfocused shock wave, it has been discovered, stimulates the cells around the wound and increases the prospect for healing and also the time for healing. So when I came across that information 10 years ago, I started using it for myself. I strained my right tendon. I went to Emory Hospital in Atlanta, and they said the normal tendon on your right side looks like a rope. Yours looks like cotton candy. So, we got off to a great start there, right? So I've used Shockwave to ultimately heal my tendon. It is not cotton candy anymore. It's strong and very viable. It doesn't pain me anymore. Now, about 9 or 10 months ago, I cut my leg, my right leg, basically my knee, on, although I don't have legs, I have a knee, a bone, and I cut my leg on my own wheelchair in a razor-thin exposure to a screw. So I ran my leg across that screw and cut the hell out of my leg. So I went to my personal physician. He said, "We need wound care." Well, initially they started using honey, meta honey. Well, that didn't work, and so there were no antibiotics used initially at all. Then the wound got infected. Then I had to start using some antibiotics. But then ultimately that did not clear things up. So I ultimately had surgery in February to get at the infection, to get down to the bone. So that wound incurred in surgery in February is still open. And the only way that I have seen to close it is to go to a new doctor, Dr. Mullins at Piedmont, and he is a plastic surgeon, and he has been using Shockwave on patients. And
he's got some pretty, not to interrupt you, but Dr. John D. Mullins, who's been working with us for a couple of years now. He's since July, Senator, he has used this after surgeries and has not prescribed an opioid since. And this could be one of the tools that we can use to get out of this terrible opioid epidemic.
No, well, actually, he did a small series of patients that where he used them post-surgically, and about 7 out of 10, if I recall, he was able to avoid any sort of pain medications. But Senator Cleland, if I recall, also you had the standard of care for wound care, which is that multi-$1,000 device rental, which was a negative pressure therapy device, if I recall.
When the wound care thing.
The wound vac, I think it was.
And did that work?
Wound vac. Hell no.
Okay.
It didn't work at all. It just was a big pain in the ass.
Uh-huh.
And so
I think I saw it in your condo as it's propping the door open. Last I saw that.
Yeah.
And we started acoustic shockwave therapy, and the wound is improving. It's not completely healed yet, but the wound is improving, and thank God for that.
Let me also tell you, you touched on a little bit of the biological effect. We're going to talk about that. Would love you to stay on, Senator. But what happens in really the first 15 hours, we see a reduction in inflammation into that area, and you see an increase in blood supply. You also see the resident stem cells that have been laying dormant activated and start circulating. And the wonderful thing, you have that neovascularization, the new blood supply. And what we tell patients is wherever you have pain, you have poor blood flow to that area, or it's an ischemic area. And that's why in a lot of our diabetic patients, those wounds aren't healing. There's over 86,000 amputations per year in the United States. And I believe this technology, Senator and John, that we can change that number not just by ones,
drastically.
But drastically. This has a transformational type of effect on patients. And we've used it on infected dog bites, snake bites, like you said, diabetic ulcers and wounds. And but there's also an antimicrobial effect as well.
Now, we're most excited about that right now because if you combine this, I just read a Wall Street Journal article that over the next 10 years, more people will die because of the inability of the antibiotics to function. They're losing their ability to work.
The superbugs.
So if you can combine shockwaves with that, then all of a sudden the antibiotic failures are now becoming successful. And so Walter Reed, if you were, we can go back in history with that, but at Walter Reed now they are starting a study fully funded by the government with our shockwaves device with antibiotics that are failing to prove that we can extend the useful life. And the funny story about Senator Cleland is we walked into his office. He was just being kind to see us through some lobbyist or something. You were at Import-Export Bank the first time we met you. And we were telling him all these neat little stories. But then when he showed him some slides of these mouse studies in this third-degree burn model to where the mice were getting their hair back, that was the first time I think we got your interest. And he grabbed me and gave me my first professional noogie on my head.
Good. And the other thing the really thing that's exciting, Senator, is a lot of these regenerative medicine and anti-aging longevity clinics around the country, they're starting to see the benefits because in 8 to 10 weeks after treatment, you're getting your own stem cells migrating to that treated area, which is very evident in the research and an exciting part of this. And I think why, the FDA has been really knocking down on some of these stem cell clinics because they're using, material that has not been cleared or approved. And this way we are allowed to use a device that activates our own natural biological healing components.
Yeah, it's beautiful. It takes all the politics out of stem cells. So you no longer have to have the arguments about what type of stem cell lines are appropriate or embryonic or umbilical cord or those hundred of other options that are not yet proven. And in fact, they've been disproven in Europe over the last 10 years. They've walked away from that technology. So, but here in our medical community, it's a way to make money. And so it is the current, it's the current buzzword right now. You'll see it everywhere. A series of stem cell injections for $10,000, for instance, for pain of the knee.
I can tell you that over the last 2 months, I have tried everything in addition to Shockwave. The doctor has put in pig valves. I mean, not pig valve. Pig.
Glue. It's like a glue they make. Yeah, it's a tissue. I've seen it. It's pretty cool.
Yeah, and from a pig. And I have a cow valve in my heart, and I wonder if I'm going to moo or if I'm going to get down in the mud and what I'm going to make love. I just don't know. But
It's,
from the pig valve to turmeric. Turmeric is used in India as a healing agent. We've tried all of that. We've tried everything except Jim Beam, and I think that's the next. that's the next deal.
Well, Senator, we want to thank you for coming on. We're just about to wrap up, so thank you so much and everything you've done for the residents of Georgia, and really a big shout out for helping TRT get to a national level. And I look forward to seeing you again in person.
Yeah, and many thanks. Senator Cleland was responsible for. We had a $10 million. What they call them, bookmark way back when grant that we did a huge study for the warfighters coming back from Afghanistan at Walter Reed. So that was an exceptional study, and the industries learned a lot from that, and some amazing publications came from that, and it was all due to Senator Cleland's efforts on our behalf about 10 years ago.
Thank you for your service.
Thank you, Senator.
Thank you.
Bye-bye.
Bye-bye.
So we touched on a lot in this second segment, and John, again, thank you so much for helping go over the history of this soft shockwave device, and which we refer to as a stem wave. You know, in future segments, we're going to have different doctors coming on, and we're going to talk more on a cellular level and how is this affecting or creating, jump-starting our mitochondria, which are the powerhouse to the cells. And so we'll have Dr. Michael Carter, who's going to be coming on, and we'll have Dr. John Mullins as well, who's at Piedmont Hospital and using this device. So those are some of our next guests, as well as Isaac Jones, who used to be one of my students at Life University and went on to become a pretty international virtual clinician, and he tore his ACL. So we'll be talking with Dr. Jones in our upcoming segments about his healing journey. Welcome back. And this is our second half of episode 4, and we just had Senator Max Cleland on, and what a treat and what a wonderful guy and gentleman to come on and give us his background and how he's had more visits than anybody maybe that ever, more shockwaves delivered into his system. And he's a triple amputee, and let's not forget about that and some of the wonderful things he did. He ran the VA center, you said, as well for 6 years during.
Yeah, and he's quite interesting. He was a President Obama appointee for the VA, and he was a Senator Bush appointee for the Import-Export Bank. So
Pretty
that
cool.
was that's a rarity nowadays. Yeah. The combination.
That is. So in this segment, we're talking about, my mission statement used to be, treat locally, but think globally. And honestly, this device has allowed us to do that now, because with the results that we're getting, and you can go to freemypainnow.com, our website, you can see some of the amazing case studies that we're documenting via video, because people won't believe it. The wonderful story about Miss Doris Adams, who after chemotherapy wasn't able to walk for nearly 2 years.
The chemo dance, if I recall.
That's right. She had the chemo dance, and people can see that on Facebook, and she's had millions of views now. But we saw that, and we saw that as an opportunity to teach others who were suffering from this what can happen. She had a double whammy. She was both diabetic and a chemo induced peripheral neuropathy. So we met her at one of our seminars, and so we documented that first day. And then she came in. We documented every stage. We used low-level light therapy as well, and some balance stuff. We did some testing. And we looked at her blood flow, which was not getting down to her distal extremities, which are her toes and the balls of her feet. So we knew we had to make some changes. And then we did the soft shockwave treatment, and we did just about 300 shockwaves on each foot. And I don't know what happened, but it really energized her, jump-started her, and she was able to jump off that table, slide off it, and walk without any assistance. And she was blown away, and she's probably one of our most famous patients. And then we followed her for the last 6 months, and she has a whole new look on life. I mean, she now is able to go to movies. She can go back to church. She actually bought tickets to the Atlanta Falcons this year. She's a big Falcon fan. So it's not just about getting these patients out of pain, but it's allowing them to enjoy their lives. So it's like I said, we use incremental devices in our clinic that help every day get better, but this has really been transformational for some of the patients. And John, why isn't, what's the technology? I know we're just scratching the tip of the iceberg.
You know, it's a very interesting, because every 2 years we reinvent ourselves. We find something new and improved. But for years we've known it had a biologic effect. We always said it was neovascular. And then there's so many different iterations of that. And then for the most recent discoveries and what launched us is we proved that stem cell attractants were produced wherever you aimed this shockwave. It fooled the body into thinking it was been injured. Essentially, the cell walls became permeable under the tensile portion of the shockwave. And because the cell membrane was permeable, exosomes are discarded into the bloodstream, and all the neighboring cell receptors would see this as a signal to turn on the biologic pumps. So essentially, we fool the body into thinking it's been injured. The body's own biologic pumps are turned on. But the most important part of that, and what distinguishes us from any other technology, is not the stem cells, it's the stem cell attractants. You can put $1 billion into the ischemic heart of any patient, and if that injury was over 12 weeks old, the heart thinks it has healed. And of those billion stem cells, maybe less than 1% will stay and be effective. The balance will find themselves within 24 hours or in the kidney, the liver, or the lungs. But what we do is we make the stem cell attractants. So not one, we're calling, most importantly, our body's own stem cells. Dr. Liu just presented at the AUA.
Dr. Thomas Liu out of University of California,
He is the father
San
of
Francisco.
urologic research. He just presented that within hours. The resident stem cells, the mitochondria, are fired up. They show that they go to work within hours under the influence of shockwaves. But more importantly, the migratory, they show that stem cells migrate from the bone marrow, from the fat, and within 24 hours, there's a multi-thousand factorial increase of migrating stem cells. So, and all that's neat, but if it was not for the stem cell attractants, that they would not know where to go or what to do. So all of these other, quote, stem cell therapies, they're essentially moot, and they're at a huge disadvantage to us because the body thinks it is healed, and if there's no stem cell attractants in place, it really doesn't make sense to inject 1 billion stem cells.
We're excited. You know, our most valuable source of information is our patient and their results, and that's what has really fired me up about being part of this company and helping it bring it to a national level. You know, one of the things that we're seeing also is, I believe you said in Austria, they're using it, the cardiac wand over the heart to help break up plaquing and things like that. Can you?
Yeah, well, very quickly, what they do in the ischemic heart model in Austria, Vienna and in Vienna and Innsbruck, when they crack the chest for bypass grafting, they target the scar tissue of the heart. Now, we did all the animal models. We've actually done 10 humans. And in the history of ischemic heart model and stem cells, including all stem cell therapy, there's never been a better outcome in the ischemic heart disease. We were able to increase the ejection fraction of the heart by, I think it was 25%, versus 5% was the maximum ever for any stem cell therapy.
So ischemia, again, lack of blood to that heart after a myocardial infarction or a heart attack, the tissue is damaged and blood can't get in there. My dad, rest in peace, he's been gone for almost 22 years, but he died from congestive heart failure, which was basically he had a bad heart attack at 58. His ejection fraction was reduced by half, and there was really nothing but drugs and medication. So I'm really excited about the cardiac.
No, that's the most exciting for us. And as far as if you look at the business of this, there's a company called Shockwave Medical that just went public a few months ago, and all they do is treat the calcified aortas and
again, so they're almost like an angioplasty.
It's intravascular. They
so
put
they're coming
an
up through the artery,
and they put inside the balloon. They put 2 shockwave tips, and they put shockwaves, unfocused shockwaves, and they focus it on the plaque in the aorta, and they have almost an immediate relaxation of the aorta, so you get the pain relief, you get the improved blood supply.
Arteries, yep.
And it's a great idea, and that company's worth $1.5 billion. and whatever they can do, we can do better, faster, cheaper. So
Let me ask you, have they treated actual patients here in the States yet?
they started out with peripheral artery disease, PAD. They validated that. And I don't want to be too careful because they're somewhat of a competitor when I wish them well, because if they're worth X, we're worth 5 times X. So the FDA tends to accept a PAD model. If you can validate yourself in that model, then they let you go to the calcified aorta. We treated our first calcified aorta in Austria well over 10 years ago. And this is something we're going to get around with, but it's not the calcification that's important. We'll leave that for others because we don't even think it's a good idea to treat the calcification. Our studies that we are starting at 2 heart centers, very prestigious, I can't announce right now, if we treat substernally, non-invasively, treat the heart with unfocused shock waves, we can essentially modulate heart disease. Heart disease is inflammation. We make inflammation go away. We just had our first reported case study. A highly inflamed, high PSA patient was treated by one of our customers. I don't know why he did it, but he did it. And within 72 hours, I think his PSA levels were cut by half. So we modulate inflammation, all inflammation. Disease is inflammation. So once again, our biggest asset is our biggest threat is that we are almost too good to be true. What does not benefit from a stem cell response? What does not benefit from a neovascular response or the ability to modulate inflammation? And so therefore, we find ourselves, getting distracted. I'll be talking to cardiologists and all they want to talk about is something else. But it's
right. So one of the things I say is the soft shock wave may be the most versatile device, but it also may be the single safest therapy that we've seen in the history of medicine now.
No, that's the beautiful thing about it. There's no risk.
And we've used it on every organ on the body. Even Dr. Michael Carter, who has macular degeneration, we use it on his eye. He's the first patient in the world that we've used it on the eye. And we're going to have him.
I don't think he used it on himself. Thanks goodness. I'm not even sure we would have done that.
So there's that part. Inflammation is the silent killer. Back in 2004, on the cover of Time magazine, they talked about where does plaque come from, and this is one of the things that we want to chat about in future episodes. Inflammation really causes that scarring tissue and the plaque buildup, and it's not from cholesterol. You look at the ketogenic diet, which I've been on for 3 months, lost 22 pounds, it's high in fat. It's 40% fat. It's 30% carbs. So we're looking at some of that stuff. I'm so excited.
Yeah, calcification is not the enemy; it's inflammation.
That's right.
We've proven that in the heel spur model and the calcified shoulder model. Once you have an injury, over time, if it remains inflamed, unhealed, that chronic inflammation attracts the plaque, attracts the calcification, and that has no effect on the pain. That's not what you're treating. You're treating the inflammation. Too many people have been trying to attack the plaque as their enemy. The inflammation's the enemy, and the enemy of inflammation is soft waves.
That's right. We get it. That's what makes our group a superhero healing. So that's what I think. It's elevated the care we've been able to give to our patients in our community. I do say soft shockwave is, although it has a wide range of effects and it's very powerful, it should only be considered in light, a part of a comprehensive, individualized approach to a patient, right? So we like to have the diagnosis. We like to have the treatment plan. We like to see the baseline studies. And we've talked about what we've done with patients in our overview study of 152 type 2 diabetic patients and what we did to cut their pain in half. And we'll talk about that in future episodes. John, it's been such a pleasure having you on and thanking you.
See you soon.
Yes. And
thanks for all you do. I love your testimonials every morning. It wakes us up. You have the Hall of Fame of some of the best patients we've ever seen.
We really do. And you can go to freemypainnow.com on our YouTube channel or our webpage. And thank you guys and listeners.
Next week you have to talk about these stroke patients. That's the most exciting thing we're doing.
We can't wait. Thank you, and we look forward to our listeners at the next episode.